Good morning. This is Dustin Reno, nurse practitioner with Pocatello Wellness Clinic. I hope this video finds you well. Today, we are going to be talking about another medical condition that is becoming more and more prevalent, and that is diabetes. So the first question is, what is diabetes? Well, diabetes is a disease where your blood glucose or blood sugar is too high, okay? The levels in your blood of sugar are too elevated. And as we know, the blood glucose or blood sugar comes from sources of food that we eat, particularly carbohydrates, or it is found in other foods, refined sugars such as sweets and things like that we can purchase at the store. So with diabetes, what is taking place is our pancreas produces a peptide called insulin. Insulin is used to move blood glucose into cells, where the cells of our tissues use that for energy. Well, with diabetes, what may be happening is our pancreas is not making enough insulin for that process to take place, for our body to use our sugar effectively, or it is making too much insulin. Okay, in the event that your pancreas does not make enough insulin, then the glucose remains, or blood sugar remains in your blood and stays there and is elevated. And then the long-term side effects of that are very unpleasant. There are two types of diabetes, type 1 and type 2. With type 1 diabetes, your pancreas typically does not make insulin, or if it does make insulin, it's in very small amounts. What has happened there is that your body, it's kind of an autoimmune thing. Your body makes antibodies that attack the pancreas, the islet cells in the pancreas, resulting in their inability to make insulin that you need to use your blood glucose or blood sugar for energy. Type 1 diabetes is typically diagnosed earlier in life, so in childhood. And that's one of the ways to differentiate between type 1 and type 2 diabetes, which is the other type of diabetes. With type 2 diabetes, again, your pancreas is not making enough insulin, or the insulin it does make, your body does not use well. You may have heard of the term insulin resistance. Okay, type 2 diabetes typically occurs later in life, and is oftentimes associated with poor lifestyle, okay, or poor diet that has over a long period of time resulted in your body's inability to use your insulin that your pancreas does produce due to the chronically elevated blood glucose. So as far as risk factors go for developing type 2 diabetes, there are a few. One of them is age 45 years or older, being overweight, having high blood pressure, having elevated cholesterol, being physically inactive, okay? And there is even a genetic component to this. But as mentioned, a lot of these risk factors are factors that can be addressed or even avoided earlier on in life. So what are some of the health problems that can take place with uncontrolled or untreated diabetes? Well, there are a few. Everything ranging from eye problems, so poor vision, heart problems, nerve problems where you get numbness and tingling in your hands and in your feet. It can cause dental disease. It can cause foot problems, stroke. It's a disease that we want to make sure is being well controlled and addressed early on, because again, the long-term outcomes are really unpleasant. How can we control your diabetes? Well, according to the American Diabetes Association, there are some lifestyle changes and measures that we can implement that will have a huge impact on our health. As far as diet goes, your diet needs to include fruits and vegetables, green leafy vegetables such as kale, spinach, broccoli, and even citrus fruits. Citrus fruits have been known to have really good antioxidant effects that are very beneficial for diabetics. Lean protein, I cannot emphasize this enough. Foods such as fish with omega-3 are very beneficial to diabetics. What should be made note of, though, is when eating protein and carbohydrates, make sure you eat them in combination throughout your meal. The reason being is when you eat a protein and a fat with a carbohydrate, that protein and fat allows, as your body digests it, it allows for a slower release of sugar from the carbohydrate, which in return will not spike your blood glucose as quickly or for as long. And so it's really important you eat both of those foods together. Another important aspect is to make sure to choose foods with less added sugar, because again, we're just adding fuel to the fire when you consume extra sugar. As far as foods to reduce consumption of or even avoiding is really hard, so I would just encourage you to maybe reduce the amount you do eat, are things like white bread, puffed rice, white pasta, white potatoes, popcorn, melons, things that are really high on the glycemic index. So what types of medications can be used to control diabetes? Unfortunately, as this disease progresses, lifestyle intervention may not quite be enough to control our blood sugar. Well, there are two types. There are oral medications as well as injectables. The types of oral medications that can be used for management of diabetes include everything from medicines I'm sure we're aware of or that you've heard of, like metformin or glipizide or Actos. Those are meds that we can use on a daily basis that will help our body utilize our blood sugar as effectively as possible, as well as increase our sensitivity to insulin that our pancreas is producing. And then obviously another type of medication used to control diabetes is injectable insulins. There are different types, both long-acting and short-acting. It's important when working with your healthcare provider that you determine what would be most appropriate and how you would respond for dosing so that your blood sugar levels aren't getting too low. How do you monitor your blood glucose levels? Well, there are two ways. One of the first way that most people do is via a finger stick. You have a little glucometer, you clean the side of your finger with alcohol, poke it with a little lancet, put a drop of blood on a strip, and it will give you immediate results on where your current blood sugar is. Another way is they're coming out with these monitors that are implanted into the tissue on our body, covered with a dressing, that provide us with continuous results or feeds of what our blood glucose levels are. The cool thing about those is they don't require a finger stick every time. Once the monitor is in place and covered with that dressing to hold it there, at any point in time you can scan it, or the information can be fed directly to your smartphone, tablet, computer, and you can have instant results of your blood glucose. The American Diabetes Association recommends that for your blood glucose levels, your pre-meal levels, so before you eat, should range between 80 and 130. After you eat for 1 to 2 hours, we call that postprandial, that blood glucose level, the blood sugar level, should be below 180. How is the AAIA helping their members control their diabetes most efficiently? Well, they offer, and this is really cool, they offer a service for their members where they can use their ProAct ID and acquire a Dexcom G6 continuous glucose monitor. It's one of those monitors I mentioned earlier where the device, the little reader, the scanner sits on the skin. There's an initial poke, the catheter sits inside, you cover it with a dressing, and then it provides a continual feed of your blood glucose whenever you desire, so you don't have to poke your finger all the time. It's really awesome. That benefit can be used using your ProAct ID at you can pick that up at your local pharmacy. There will be no prior authorization for that device. You just need a prescription from your provider. As far as cost goes, what you're looking at is the reader, there's a $25 copay. The transmitter, there's a $25 copay. And the sensors, for which you get 3 per month, are a $25 copay, which I can tell you as a clinician, that is a really good deal because typically these devices are much more expensive. People that I work with in my clinic that need to check their blood glucose frequently often comment that they wish they had one of these devices. So I would highly encourage you to get one of these if you are a diabetic and checking your blood sugar regularly, because it will save you so much time, so much hassle, and you won't have to poke yourself all the time. If you have any questions regarding your benefits and acquiring the continuous blood glucose monitor, the Dexcom, you can contact the III-IA Benefits Manager at 208-938-8199. Thanks guys, we'll talk to you soon.